So what can our healthcare providers or community partners do to help someone with that?
I think there's a role for both the community providers and for the patients.
Okay.
So we talk about something called health literacy, where it is what a patient learns so that they can understand what the health community is telling them. So learning about what diabetes is, learning about what all the medications are for. There's a lot to learn if you're going to have a chronic disease and manage it well. You have to really understand what everybody's talking about. That's one kind of health literacy. The other kind of health literacy, though, is how do we as a healthcare community talk to people in a way that they can understand. So how do we say it in a way that's easier to understand so that you don't have to learn 57 things in order to know what your medication does, so that you can understand why you're coming back to the doctor, why you need to change your medicine. Because these are dynamic diseases. They change as your weight changes, as your diet changes, as you get older, as you go through menopause. All these things that happen to the body change how your disease is operating, and you're going to need to understand the decisions that go along with that, the changes that are going to be made in your medications, or not needing medication, or needing another medication. All of that is very dynamic, and so you have to be an interested and involved person who is dealing with a system that is really working hard to make sure you understand. If you don't have both of those, then it can be very hard to manage. And that means that if you have a problem with transportation or getting the food that somebody's asking you to get, you have to say so, because there are resources, but they have to know that you need them. So right now we're doing a couple of different programs with folks that if we know that you have a problem, you might be able to participate in. So some patients are being enrolled in an Instacart program.
It's wonderful.
Where we're working with Instacart to give people the ability to have their groceries delivered. And that means hopefully that they're able to get over some of those barriers of transportation or other issues that keep them from getting to the store to get those fresh fruits and vegetables. Maybe you can't get to the store often enough to have fresh because it'll go bad in your fridge. Well, now you can have Instacart deliver it. That's a help, but only if somebody knows you need that help. So you have to be able to tell the doctor, oh, I can't do that. If you're the kind of person who can't get their medication follow-up visits, maybe they can do those by telehealth. Maybe you can get them delivered from the pharmacy, but only if they know you need that. And the same thing on the provider side, they have to be able to ask, I'm asking you to do something, are you able to do it? And not just presume. So everybody has to have much more thoughtfulness about how to get the information back and forth than they maybe had in the past.